Good afternoon, good evening, everybody who's on here for this wonderful Coach Week. A warm welcome. We've had over 3,000 registrations from across the world, so we are broadcasting internationally, and it's just lovely to see you on the line. I'm Heather Jane Gray. I'm the Chief Exec of Synergy Global, and on behalf of the Synergy Global team and our strategic partner, OpenDoorCoaching Group, a warm welcome. I must say I'm enjoying Natalie's positive energy and the support from the Open Door team who are doing so brilliantly with tech. Apologies for the slight delay this morning. We've had some hiccups with virtual working and technology, but hopefully we've now got that sorted. So Sam's got control of the slides, so perhaps you could just pop on the next one, please, Sam.
Sure. There's a little delay, so you probably
acknowledgement of country. We acknowledge the traditional owners and custodians of the lands on which we meet today and their continuing connection to the land, waters and communities of Australia. We pay our respects to them and to their elders past, present and emerging. Just a slight delay with slides, I don't know why. So an introduction to Sam. I'm delighted to have Sam with me here today. Sam is our Synergy Global team leader for New South Wales, and she focuses on health and wellbeing services. Sam has worked for 15 years in health and wellbeing, plus the field of innovation. Earlier in her career, she was a marketing executive with Unilever in the UK. Her work has been in both the UK and Australia, where she has run several businesses and formulated successful approaches to resilience, treating stress and anxiety. She is an expert holistic counsellor, and she has improved the lives of countless individuals. Since she became an ICF credentialed coach in 2014, she has used her knowledge of psychology to bring an insightful approach to individual, team, and organizational well-being, using effectiveness consulting, change facilitation, and executive coaching. She enjoys speaking on diverse topics, including a wide range of self-mastery workshops. These are customized to client requirements, of course, after the first initial assessment. So welcome, Sam. It's wonderful to have you online this morning.
Thank you so much, Heather Jane, and what a pleasure it is to be here speaking as part of this amazing event put on by Open Door and Synergy Global. And it's just a great honor to be a keynote speaker. And, you know, whenever you listen, I don't know about everyone else listening, but whenever I listen to an introduction about myself, I always think, oh, wow, is that me? It's quite a nice, affirming way to start a presentation. And thank you, Heather Jane. And I wanted to just talk a little bit about why I'm qualified to talk about anxiety. And that's really because for the last few years, I've been specializing in treating anxiety specifically. And so that's stress and anxiety and wellbeing issues around that. And I run a business called the National Anxiety Specialist, which you can probably see on screen if the slides are working okay. Now, during this presentation, I would really love it to be quite an interactive session. So Heather Jane has been amazing, and she's going to be managing the chat box for me because I can't actually see it because I've only got a single screen at home today. So I won't know when your questions are coming up, but anything that's appertaining to something I'm particularly talking about in that moment, Heather Jane's going to give me a nudge and let me know.
One thing, sorry Sam, to interrupt, I'm really sorry. I can't see the chat box this morning either. I've been working it all day yesterday, but it's not coming up on the screen because I think you've got control. So just to say, Natalie.
Hello there. Yes, I'm here, everyone.
You've got it.
I've got the chat, no worries. I'm on mute. Hello, everyone. Lovely to be here with you. I'm on mute. I've got the chat and really looking forward to learning from you, Sam. So no worries.
Thank you so much. Oh, good. So everyone's got it under control. I wanted to start with a little story this morning. I was just getting ready for this keynote this morning, and I was doing a bit of breath work and a bit of centering. And I suddenly thought, I just don't feel right. And I looked down and I had my UGG boots on. Now, how is that for COVID-19 events? You know, where else would you be wearing UGG boots except at home? And I thought, I can't do a keynote speak speaking engagement with my Ugg boots. So I had to go and put shoes on, proper shoes, so I felt professional. And it was just a real sort of home working virtual moment for me, which I just thought I'd share with you because I found it quite amusing this morning. Now, I'm just changing the slide. I'm not sure how much the delay is, but I'm going to start speaking anyway and telling you about what we're going to cover today. Now, firstly, anxiety is a very normal thing that we all experience. So I want to define for you what I would consider normal anxiety and abnormal anxiety. I think that's quite important. And also talk a little bit about the prevalence. Now, stats are not very interesting unless they're quite mind-blowing figures, but it's important to just kind of get a feel for how prevalent anxiety is generally. And we're talking before even COVID-19. So now the figures will be much higher. And because it's so important in terms of the mind-body connection, I'm going to go on to tell you a bit about anxiety physiology. Now, I'm aware that a lot of you out there will already know about anxiety physiology. So I would, bear with me if it's something you know, but for the people online that don't know, I would really love them to have a bit of a feel for why it's so important. And as part of that, I'm going to go on and talk about the saber-toothed tiger syndrome. Now, then, because we're actually going to talk about specifically how you can help clients who are anxious, I want to just be clear on that. It's not how to coach anxiety in a client. It's how to coach clients who are anxious, because that is going to be at least 50%, if not much higher, of your clients. Now, I've got a bit of a chat coming through, and I'm just going to have a look at that to check that it's nothing that I need to know now. Okay. Okay, you guys have got a handle on that, so I'll carry on. So then we'll go on to 4 steps to effective anxiety coaching, and then a topic that's really close to my heart because it's very important around this issue, which is the stigma, shame, and stumbling blocks around anxiety, and then how to directly engage with an anxious client when you find you've got one. And then I really would like to have time for a Q&A, so we're going to watch the time. Let me know if I'm going too fast, but I want to pack as much in as possible to give you great value, and then have some time for some Q&A at the end. So that's what we're going to do today. So let's get on with it. So when is anxiety a problem? Well, we all feel anxiety. It's very normal. We all know we feel anxiety. I feel anxiety before I present, that first kind of 10 minutes before. It's a human and normal part of living. But it's an issue when you make frequent decisions based on your anxiety. And in those decisions, your anxiety is the thing that stops you saying yes. Now, if you are a chronically anxious person, it doesn't mean that you have high anxiety, but it means you have anxiety a lot of the time. So even low anxiety at chronic levels, i.e. most of the time, will be severely affecting your life. And the difficulty with this is because anxiety like that often creeps up on us, we don't really know if we're anxious or not. And we get so used to that sliding scale of increasing anxiety that we actually think that we don't suffer from anxiety. And it's only when we start working with someone and it pops up that we realize that it's quite a problem for us. So I wanted to just make a distinction first, which is saying no to things is fine. And knowing what's not right for you and saying no is not the same as saying no because you feel you cannot say yes. So I just want you to sit with that idea for a moment. It's really important to know yourself, know what you need, know what you feel, and know what's right. So there's no problem with you saying no to lots of things. The problem is if anxiety is the thing that's driving you to say no, and actually without anxiety, you'd say yes. So that's really the distinction. If you're wondering whether you are an anxious person or someone you're coaching is anxious, that is a little place where you can start to ask some excellent coaching questions very gently to see and determine and distinguish where that person is sitting. So let's have a little look about the incidence of anxiety. It's massive. I was looking up again some more figures this morning, and I was reading this morning that about 45% of Australians between the age of 16 and 85 will suffer from a mental illness in their lifetime. And of course, those figures are always skewed and underreported because a lot of mental illness goes undiagnosed and people just live with it. So if we look here, the incidence of anxiety disorder figures range from about 25% to 49% in Australia alone, depending on what source I was looking at. But according to Beyond Blue, 26.3% of Australians have experienced an anxiety disorder itself. That's around 5 million people, and that's a lot of people. That means that you go into a coffee shop and there's bound to be several people in there who are suffering from anxiety at that moment. So we spend a lot of money on mental health in each country, and the figures in the US are even higher. And basically, the talked about and used figure is that 1 in 7 people in Australia suffer from anxiety disorder. So what are these disorders? Now, they're GAD, which is general anxiety disorder, panic disorder, or social anxiety. And these are obviously diagnosable conditions. That means you will have got so bad, so disabled by your anxiety in your life that you would have gone for help and you would have received a diagnosis, which means you would have gone beyond your GP for a referral to a psychiatrist or psychologist. So if you imagine all these people out there who whose anxiety is managed by them, who they think is actually quite normal to feel like that because, as I mentioned earlier, they've slid into that gently over time, months and years. This is these figures will be extremely underreported. So it's a massive, massive problem. So where do we go next really with this? So we know it's a problem. I think understanding this anxiety physiology, as I mentioned earlier, is so key because anxiety is usually split into 2 types. There's cognitive anxiety, which is caused by the way we're thinking, things like rumination, worry, perfectionism, those kind of things that causes anxiety in the body. To give a real life example, if I was going to be really anxious before now I would have been thinking, oh, what if the slides don't work? And what if I forget what I'm going to say? And what if my mind goes blank? Now that's a really good example of normal anxiety because it's something that one could be anxious about. And we'll go on to talk about the relationship between cortisol, stress, and performance in a little while. So let's get into brass tacks of physiology. Now, we have our central nervous system, which is basically our brain and our spinal cord. And then we have our autonomic nervous system, so our ANS. And this is called autonomic because we do not have conscious control over it. It's actually governed by a primitive part of our brain, which is referred to as our reptilian brain. And it's basically sited in the brainstem at the back of your brain here. And we don't have to think, oh, I better breathe now, or I better digest my food now. Those things go on automatically, and they're all governed by our autonomic nervous system, or the ANS. And this has 2 branches, so it goes like this. And one side is the parasympathetic, which is our rest and restore. And the other side is our sympathetic, which is our fight and flight. Now, when we are anxious, it means we have our sympathetic nervous system activated. And it means that the body is pumping out stress hormones, such as cortisol and adrenaline. Now, cortisol is a really interesting hormone, and it's really important. We need it. Cortisol serves us in so many ways, and if I had more time, I would go into that. But we have 2 types of stress. We have a positive stress, which traditionally was referred to as eustress, and then we have stress. And there's this established and researched effect of cortisol, whereby as cortisol increases, our performance increases, and they kind of go alongside each other at the same rate. But as cortisol continues to rise, we reach a point at which our performance does a complete downturn, creates a peak of a mountain and drops off the other side. And I put on this slide exam nerves because that's a perfect example of when our cortisol levels are too high and cause our performance to actually drop off. Now, you probably know people, or you may be one of those where, you know, you may have been really good at school, really good doing assignments, you get top marks, and then you go into exams and you perform pretty averagely or even quite poorly in your eyes. And that's because cortisol, when it gets to a certain level, takes your cerebral hemispheres, basically your thinking brain, offline. It basically goes, okay, you're out. Because cortisol is all about saving you, and I'm going to go on to talk about that in a minute. So what happens health-wise when we have cortisol pumping all the time in a chronic anxiety situation? Well, we have lowered and compromised immunity. And we find that small detailed things are quite difficult, but we can still do the big picture. And long term, it causes inflammation in the body, and every chronic disease is a result of a form of inflammation. And we tend to have poor concentration and a foggy brain. So I want to talk to you about saber-toothed tiger syndrome. I don't know whether that's a phrase that I coined or whether it's just out there. I can't really remember, but it's a really useful phrase. I want you to imagine for a moment that you are someone living in cave times. And I was actually checking this out, whether saber-toothed tigers actually lived during the time when men were in caves, or whether it was they predated. And in the end, I decided it didn't matter. So here we are. Imagine that you are a caveman or woman, and your tribe has just indicated that there's a saber-toothed tiger on the prowl in the vicinity. So you head back to your cave. And to do that, your cortisol pumps out and your adrenaline so that you can you can mobilize your muscles, you can stop digestion, and your heart can beat faster, and you can get back to your cave, because it's incredibly important that you don't get eaten by this tiger. And while you're in this cave, you may not be able to get out again to hunt for food and eat for a very long time. And so therefore, we need to make sure that you don't get too skinny and that you've got fat reserves to survive. And so this is an amazingly adaptive mechanism of your body to save you in times of great stress. And so cortisol has a fat storage. It basically lowers the rate at which you burn fat and helps you store fat. So it keeps you alive for longer in these extreme situations. But the trouble is, in modern day life, we don't have any tiger to run away from. We're not in a cave without food. But we can feel the effects of cortisol and have these very sort of established chronic anxiety issues going on a physiological level all the time. And this, there's bound to be at least half of you on the line who understand exactly what I'm talking about. And the other lot of you will probably meet people or know people who are like this, who basically run all the time on these low levels of cortisol, and they're kind of stuck in this high stress situation. So what I'd like to do is teach you a couple of techniques to modify anxiety with your clients. And they're very simple, but let's do them together. So indulge me. And if you know this work already, then it's a perfect time to make a cup of tea. But if you don't, then do this with me and we'll go through it together. So let's start with breath work. Okay. So the reason I'm teaching you some breath work is that in order to switch off our sympathetic nervous system, and therefore our cortisol and our anxiety, and switch us into the parasympathetic nervous system, we actually need to change our physiology. And breathing properly switches us from one to the other, and breathing improperly in a shallow way switches us from our rest and restore parasympathetic into our sympathetic. So remember from the last slide, if the saber-toothed tiger is prowling around, we will breathe rapidly and shallowly to get oxygen quickly as we run back to our cave. And that's exactly what we do, what we tend to do when we're anxious. So this is reversing that. If you've never done this before, then it would be a really good idea after the seminar later today to practice it actually lying down, because when we lie down and do this exercise, the weight of our body on the vagus nerve, which is a long nerve that runs down the spine, actually helps the switch over from your sympathetic to your parasympathetic. So what we're going to do is breathe deeply and exhale. And we want to breathe in a special way. We want to breathe right down into our belly. So we don't want to look good with a flat stomach, not that I've got one anyway. We want to make that tummy really protrude and extend outwards. And the way we do that is because we're breathing oxygen right down into our lungs. Now, when we breathe shallowly, we are not really using the capacity and the functionality of our lungs in the right way, because all the little air sacs that take in that lovely oxygen are at the bottom of our lungs, at the bottom third. And so we need to push air right down into the bottom, and that makes the diaphragm bulge down, which makes the abdomen and the organs in it, mostly the digestive tract, protrude out. So that's what we really mean by belly breathing. And a really good way to do that is to put a hand on the chest and a hand on the belly. And you really want the hand on the belly to be moving and the one on the chest to be barely moving. Now, obviously, the chest hand will rise a little bit, but most of us predominantly make this hand move on the chest and don't really move the hand on the belly move. So we want to breathe in for 3 to 5 counts, nice and deeply into that belly, and feel it expand. And as it expands, at the end of that inhalation, we want to pause gently and just wait for the body to be ready to exhale. Now you do this in your own time, but I'm going to keep speaking and talking you through it. So we want to breathe in again for 3 to 5 counts. And if you can breathe in for longer, nice and deeply into your lungs, then you do that. Then you have that lovely pause at the end and let your breath slowly and steadily exhale and your belly fall back down or in towards the spine. Now, when you've come to the end of the exhalation, there is another pause before you need to breathe in. So it's about learning how to allow your body to tell you when you need to breathe, because you'll find initially that it's difficult to have a nice long exhalation and inhalation, and you have to do it at least 5 times to enable that to happen. And when you do that, you're actually feeling the physiological effect of switching off your stress hormone response. You'll feel your body start to calm, you'll feel your body start to relax, and you'll feel your breath become easy rather than forced or ragged. So just take a couple more breaths if you're doing it with me. I'm going to do a couple now. Okay, so any of you who've done it with me, I hope that you're feeling much more relaxed and chilled out. And you can notice that if you go straight into being highly functional, doing your emails after you've done your breathing, etc., you will switch yourself back onto your sympathetic nervous system. So if you're very busy and you've got a lot on, it's really worthwhile checking in and doing a few breaths, say every hour. Even if it's just 5 breaths, it's going to really help your physiology and therefore really help your cognitive function and your physical function. Now, the second technique that you can use with your clients is called creating an anchor. And it's a very simple technique that uses the neuroplasticity of your brain. And a lot of disciplines use a kind of technique like this. And this is something that you can teach your coachees or your clients, and then they have to basically practice it. And so what we're doing is we're linking a finger and thumb together. Now, I don't use my index finger and thumb because I might do that in some other way at some other point. That's a gesture that I might make. So I use one of my other fingers to do this. But you want to make firm contact, not pressing, but you want to make contact. You want your brain to know that there's a connection there. And then all you're going to do is think of a person, place, or object that makes you feel peaceful and calm. Now, I've had clients say my grandma or my dog or a beautiful beach or a beautiful field or park. And you want to close your eyes and really bring that place, the person or an object to mind. It may be a teddy bear, for example. And the important part of this is that while you've got your finger and thumb connected, that you actually start to to feel the feelings that you have of peace and calm that person, place, or object brings you. And it's the experience and the feelings and feeling all the feels and connecting it in your brain to the action of your finger and thumb together that actually causes a connection. And what we need to do is practice this for about 5 minutes or 3 minutes minimum daily for 10 to 14 days. Now, some people will get it in about a week. Others will need the whole 14. And it really depends on your physiology and your neurology. So what happens is once this is fixed, what you need to do when you're feeling anxious. So say you've got a client who's, gives a lot of presentations, for example, and gets quite nervous, or has a meeting with the boss, or has some difficult conversations in relationships they need to have. Once they've established their anchor, they can trigger it by actually just putting the finger and thumb together. They don't need to sit for 5 minutes and think about peace and calm. They've actually got that fixed in their body. And this, I find, is an incredibly powerful technique. But you do need to stress to your clients that they need to actually practice it so that it's functioning for them. Because neuroplasticity takes a while to change. And we need to make sure over that 10 to 14 days of practicing that actually neuroplasticity has caused a change in the neurons and the pathways in the brain. So there are many, many modifying techniques for anxiety, and we could have a whole couple of hours on those, but these are just two that are very easy to teach. And I think they're very workable in corporate settings. Now, if you find it quite confronting, the idea as say a corporate exec coach to use these techniques with someone, it's much easier to explain that you always help someone become calm at the start of a session. It's just the way you start as a matter of course. And I would tend to always present it like that rather than present it, obviously, because you think that they're anxious. So there's a lot of chat coming up. Natalie, were you right on chat? Are there any questions at this point that I should cover?
Hello, Sam. No, we're all okay. There's just a few comments. Donna is saying practice both at the one time. So boxed breathing, the 5-second breathing, as well as the anchor.
Absolutely.
And Viz has said that in Hindu traditional dance, joining the middle finger to the thumb is a deer. She says, try it and make the move, and it feels really awesome as well. So no questions at this stage, Sam, just some nice comments.
Yeah, some great comments. Thank you for that. That's really interesting. So how do we recognize anxious clients? Now, this is really interesting because so many of us in life are, we tend to modify ourselves. We tend to adapt so much. So we may have low-grade chronic anxiety, but as I mentioned earlier, we may A, not be aware of it, or B, be aware of it, and have learned so many strategies to actually hide it. So in a coaching session, you may have a client that you're coaching. You could be an exec coach, a life coach, any kind of coach, and you're starting to see some interesting behavioral signs. And one of the things that really flags up a potential anxiety situation is indifference or irritability on certain topics, or a lack of motivation. So if you start seeing that in your client and it's quite unusual for them, I would flag up just inside your head a possible red flag for anxiety. And people who say things a lot like, oh, that really doesn't worry me, and you haven't even asked them if they're worried, or I'm really used to that and it's totally fine, I'm totally fine with that. Those kind of comments always are red flags for someone who's actually quite potentially anxious. So that's one behavioral sign. The second one is denial. If you get, I'm not anxious, or I'm a super confident person, then I would again put up a question mark. So what we're doing here is we're not trying to call people out on their anxiety. That's really their business. But if you feel like someone is quite anxious and it's preventing them from reaching their goals or growing or developing or really responding to your coaching, then this is when you want to engage with it. So I would ask questions like, are there any times when you feel less confident? So rather than say, are there any times when you feel anxious, in someone who's denying, are there any times when you feel less confident, is a really good sign. It's a really good question to ask. Now, the other thing you can look for is to feel it in your body. As a coach, you're probably quite connected to yourself and your clients. And if you feel anxious when you're coaching this client for reasons that you can't really work out, and it's not like you, I would again have a red flag over the fact that they might also be anxious. So be on the lookout for that. But also, you may be aware of a concept called projection in psychotherapy and counseling, which is when you have some unconscious things that you push onto your client. So this is a tricky one. So you need to be quite good at knowing how you feel and perceiving a difference with this client in this session versus another one. Otherwise, you could be projecting onto them your own anxiety. So I would try general questions framed as ones that you ask every client. And especially, so this is a little bit, most useful with clients that you haven't started with yet. So when do you feel most nervous? Or what occasions or situations make you nervous or stressed? And what challenges make you most anxious? So you're normalizing the idea that everyone's nervous and stressed and anxious sometimes. But please note that these questions are presumptuous. You are actually presuming that someone has stress, anxiety, or nervousness. And you're doing that artfully because you want to leave a space for that client and give them unconscious permission to be and admit that they're nervous, stressed, and anxious. So that's quite important. You're basically creating a safer anxiety for them to step into a recognition that they may have an issue. So I was thinking about how to help you best with effectively coaching anxious clients. And I just want to outline the steps in a clear sort of step format. So the first one is that we need to learn to recognize when anxiety is present in the coaching session. And secondly, we need to acknowledge it to ourselves. So we need to actually say as a coach, it's here, okay? So maybe it's our own, or maybe it's the client's, or maybe both. And if and only if, and when the timing is right, we acknowledge it with the client. Now, I'm going to talk some more about that on the next slide, but acknowledging things is really important, as you know. And then if it's been acknowledged, we engage in strategies to help the client manage their anxiety, feel better, and perform better, like some of the ones we just learned, the breath work, etc. So we're all kind of familiar as coaches with the idea of above the line and below the line. And with anxiety, because, as I'm going to talk about, it has this huge connection with shame, you have to be really careful about what you bring above the line and what you leave below the line. So when you're talking about anxiety and naming it with a client, if you can safely and sensitively, and it's enabling for them to bring it above the line, or you can ask some nice coaching questions to help them bring it above the line into their consciousness or into this coaching space in your session, then it's really fantastic because you're able to help your client engage with it. And this means that they will work with it alongside themselves if they need to, or they actually engage with dealing with it. Now, be careful as a coach. I think anxiety can sometimes be really triggered to trauma. So you don't want to engage with it in a heavy-handed way, but being able to acknowledge it when you're asking questions. And when you work with this client and they're talking about difficult situations that they may be getting into or preparing for or working with, you can acknowledge softly each time, that's difficult, that may be difficult with your anxiety. Is that part of the mix for you? So you can just basically hold their hand a little bit, which is really important. So what are the stigma, shame, and stumbling blocks that I want to talk about here? So when a person is anxious, they may or may not want to or be able to acknowledge they have an issue. And the reasons for this are really complex. And I wanted to make you aware of some of these. There is a massive social stigma, as you know, around basically any mental health issue, but especially anxiety. So what will people think of me? And social anxiety specifically is a really big one for this. Social anxiety is all around being externally referenced, going into a situation like a meeting or a party or a coffee with a group of people, and thinking not how you feel inside, but how everyone else might be perceiving you from the outside. So anxiety often forces individuals to be very externally referenced rather than internally referenced. And in life, a healthy balance of the two is really important. Now, the culture of the workplace environment is really important. There was a massive survey that was done, and if you want the reference, definitely get in contact with me because I can't remember it off the top of my head. But what that basically looked at was people's attitudes towards their colleagues with anxiety or mental health issues. And the figures were quite staggering and a little bit sickening when I read them. So there was a definite gender bias. Men tended to be much more damning and think much worse of their colleagues than women, but women did it too. So if they knew someone had an anxiety problem or had a mental health issue, they considered that person less able and less effective. So while that culture is in the workplace and the environment, it's very difficult for people to work with their anxiety or admit that they're anxious. And that's why we have to be super sensitive. So the question is with this, that a person should ask themselves is, am I safe to be an anxious person, or do I need to keep this really under wraps? And that sort of saddened me quite a lot, actually. And there's a lot of organizational culture that isn't really geared up to support these people and accept it as a main thing. I remember once way back advising a client who was so disabled by anxiety that he couldn't actually get out of bed for a few days. And I actually went against all my sort of sense of integrity and advised him, because I knew of his work environment and what it was like, to actually phone in with a gut issue, like to make up something physical. Because the strange thing, as we all know, that if you've got something physical and you're vomiting, somebody goes, oh yeah, I understand. Whereas if you say, I had a complete, emotional breakdown and I couldn't get out of bed, it sounds like there's something wrong with you. So this is a really difficult thing. And this means that it wraps anxiety in a whole kind of blanket of shame. And what happens is we tend to do two things with that. We either suppress it, which is consciously putting it away, or we repress it unconsciously. And so we put it behind us. Let's say from a psychotherapeutic perspective, we call that our shadow. And we put it behind us and we're not really very aware of it, or we are aware of it and we know we've pushed it away, or we put it in a box and we put a lid on and we sit on that lid really hard. And the more we put in that box, the more there's an upward pressure on that lid. So imagine if there's a lot of anxiety in that box, and it's causing an upward pressure like this. I don't know whether you can see me in the picture, and I'm pushing a pen up with my hand, and you're causing a lot of force to go down, to push it down. Now, at some point, that's all going to come flooding out, because the pressure of holding the force down, which wants to come up, is too great. So that's why, another reason why we have to be very careful with people who have got anxiety, and really feel and have a think and have a feel into what stigma, shame, and sort of stumbling blocks that they may be working with in their environment. So let's just go on to the next slide and think about how we can approach anxiety sensitively. So we want to avoid the word anxiety in many cases. So we use words like stress or stress management, especially in corporate organizations, or stressful feelings or stressful situations. Now that's another step removed, and that's very easy for someone to hear. We talk about nervousness and anxiety, or nervousness and stress, or stress and anxiety. And we talk about anxiety and use that word related to specific situations. So if you're coaching someone and they're about to have a difficult conversation, then we may use the word anxiety around that, because it seems quite acceptable for all individuals and most individuals to accept they might feel anxious in a moment around something, because actually that is quite normal. So if your client has identified specific things they're having difficulty with and you feel there is anxiety, it's good to name it then. You can use the word anxiety and you can be quite free with it. But the thing I want you to be most aware of is that when you name anxiety to actually help your client engage with it, and you're choosing to do so, you do that and you make that choice, because if you do that, you're enabling your client to move forwards in a more empowered way. If that isn't going to be the result of you naming and engaging with their anxiety, then don't do it. So that's a really important distinction. So you're not just out there to name or force a client to look at their anxiety. You're only going to do that if you see that if they start to engage in it, they will be more empowered, more aware, and they'll be able to grow more as your coaching client. I can't stress that distinction enough. So we're going to have lots of time for Q&A. I've probably gone very fast, but this is what we've covered today. So we understand a bit more of anxiety physiology, and that's really important because now you can explain it to your client. I don't know about you, but as an individual, I need to know the why before I'm doing anything. If you tell me why and it makes sense, then I'll do it. If you just tell me to do it, I'm never going to do it. So having that bit of knowledge, if you didn't already, about anxiety physiology and explaining how you're helping your client with the breath work or the anchoring techniques or any other techniques you use is really important and useful. And you've learned a couple of modifying methods you can use in session and with yourself before sessions. So I want you to be really watchful for hidden anxiety or anxiety denial. Remember the phrases and the ways of being that we went through. And if you name the anxiety, I want you to be really sensitive about shame issues. That's incredibly important. And support clients to succeed in their goals with their anxiety present. So it's like, once we know it's there, you can take it along with you in the bag that you carry it, rather than have it in front of you as a shield or a block towards moving forward. And if you find you've got a client that whose anxiety is really severe, then definitely seek specialized help from someone like myself or a psychologist or psychotherapist, someone who's specialized in helping people move through that. But they need that if their anxiety is really preventing their growth or expansion of their life or their career or their self. So look, thank you so much for attending. We're definitely going to have a Q&A. But before we do that, we always, this amazing conference, coaching week, have some offers. So there are 10% all anxiety programs that I have. Some of them are brief and mini courses, and some of them are really extensive. So you'll find all of them at the second link, courses at naturalanxietyspecialist.com. And the link below that, which is transformation coaching, that is a one-on-one coach. That's 12 weeks, transformative, high touch, high hand holding process to bring anxiety down to normal levels. I'd like to say eliminate it, but that doesn't really fit with the idea that we all have anxiety sometimes. Now, for organizations, there's a link there as well, and you're going to get this presentation sent to you, so the slides, so you'll have those links. But all of them, basically email me at Synergy Global. And we have other values-based leadership and cultural change programs at synergyglobal.com. So don't hesitate to get in touch with us there. So how are we doing in the chat box, guys? And let's go into a bit of a Q&A.
Thanks, Sam. Yes, first of all, let me acknowledge everything you've shared. And it's such a privilege to be able to learn from you in this space. So I was taking notes, Sam, as we went along. So thank you so much. Let me pick up, there's a couple of comments, but I'll also pick up the questions that seem to be quite burning for people as well. So first of all, Vanessa has actually offered us regarding the anchor. She said in traditional Chinese medicine, each finger has a link to the internal organ. Yes. She says the thumb and the middle finger connect your circulation and lungs, which is calming which is a calming influence. The thumb and small finger is lung and heart, and great for those with blood pressure and breath issues. So thank you, Vanessa, for adding to our learning this morning.
That's a really great piece of information. So thank you. So basically, I would say if this is the most calming one, then pick the middle and the thumb.
Yes.
We're trying to achieve, we're trying to calm the body and that sympathetic nervous system switch off.
Yeah, the thumb and middle finger connect circulation and lungs, which is calming. So that might be something for us to remember. Yeah.
Absolutely. Thank you.
So Adam and Mary have asked a similar question, Sam, and that is when is anxiety with a client beyond what we should be working with as a coach? So when, as coaches, should we refer clients for clinical support?
Yeah, that's a really, really good question, and it's easy to answer and difficult to answer. So if you feel at any stage that you're out of your depth in terms of you're coaching your client and their anxiety comes up as a stumbling block at every turn, that's an automatic referral. And I don't think it's an either or, I think it's a both and. So some clients would do really well to go and do some work with someone who's highly specialized in anxiety and come back to your coaching process. And other clients do really well if you stretch out the timing of your coaching and they have a bit of work slotting in between. So you're basically running in parallel. But it's really important to find the right kind of person to help them. And you do want someone who is a qualified psychotherapist or a psychologist who is qualified in trauma, because many people's anxiety comes from traumatic events. Not everyone, but many people, or upbringing, childhood experiences. So it's really important that you pick the right person.
Thank you. And Lisa is agreeing with you regarding the link between anxiety, shame, and possible trauma. So something for us to be aware of, which is what I've appreciated from your presentation, Sam.
Yeah.
Leanne has said also agrees with you around gender bias. She says that males are most likely to suffer in silence when it comes to depression and anxiety because of their inability to ask for help. And she says that's from Beyond Blue data. So she said being raised to suck it up and not express their emotions contributes to this. Would you agree with that, Sam?
Absolutely. And it's really interesting. If we look at the relationship between how men function culturally and sorry, what was the name of the person's question?
This was Leanne.
Leanne, thank you so much for that. So the relationship between the way men perceive themselves and the way they perceive others is completely inextricably linked. So it's basically like this. So they have a really strong cultural loading that basically says you must be strong, you can't show weakness. And they don't really have upbringing that helps them be emotionally articulate. So it's really important when I'm coaching or I'm treating as a psychotherapist people with anxiety, that they go through a process where they start to learn to recognize and name their emotions. So, and this is not really something you should do as a coach. It's because of what it may trigger. But I go through a 5 or 6 step process. And basically the first step of that is awareness. What do I actually feel right now? And this is often the most difficult step for men. They don't have that awareness because they haven't culturally been allowed to do that. And I have to say that in the Beyond Blue data, which may be the same report that you're looking at, there's also a massive cultural bias in men who have grown up in a household with English as a second language. So that's another layer of culture there. And I think we have to be really careful with this data, but they've included it in the report because the statistics were very clear. So I think that's another cultural layer. So the first step is awareness. The second step is to actually feel it more. So what is this feeling that I'm aware of having? And then we need to name it. So I teach men to name it. They often don't have a vocabulary to actually name feelings. They're just like, oh, I just feel a bit, frustrated. Frustrated is a catch-all term for most men, or confused. They're the 2 terms they use most because they cover a whole bunch of feelings that they put in a too hard basket. They don't really know how to distinguish them. We're lucky as women culturally that we have been enabled more around our emotions, and that's not the same for every individual. And I'm never speaking for every individual, you understand. It's really important I distinguish that. The 4th step after sort of awareness, feeling, naming is accepting. This is how I feel. This is okay. I can actually experience this, and I'm not going to go over or have a big problem with this. And then, if necessary, express what I need to another. Now, this is obviously a really hard step, and you can hear as I'm going through these steps how difficult this is for many people, and particularly many men, to actually do that. So that's just a bit of an insight into more of a therapeutic, non-coaching approach to men's repressed and suppressed emotion.
Thank you, Sam. I think with everything you're saying, it's I hear you talking about men, but as I'm sure all of us on the line are thinking about different situations for ourselves and different situations for our clients across both genders as well. So thank you.
Absolutely, yeah.
So Mary's asked a question. Do you also recommend other strategies such as exercise, diet, or working on your sleep?
Absolutely. So as a natural anxiety specialist, I have an 8-step integrative approach. So I actually look at nutrition, I change people's diets, because the impact of your diet on your physiology is massive. And as anxiety is actually a physiological problem mostly, then if we are eating badly and causing all sorts of changes in our body to happen, we can cause cortisol release just from the way we're eating. And then we start to feel anxious and we don't really understand that it's the way we're eating. And mindfulness is so important. Mindfulness techniques, obviously, that's a really big one. Exercise, so important. So certain types of exercise lower anxiety, and certain types of exercise increase cortisol output. So it's really important to look at the body and the person completely holistically. And then obviously I do a lot of cognitive behavior work, because CBT, as it's known, has been shown to be one of the most effective methodologies for treating anxiety. And really what it's all about is helping a client build a toolkit, and a toolkit that they're really competent in using. They're not an apprentice, they're an expert master carpenter, if you like, with an amazing set of tools. And that means as they go through their lives after working with me or another anxiety specialist, if something pops up for them, they can recognize it instantly, they can catch it, and they can put something in place internally in their mind or in their lifestyle that actually mitigates that and helps them move forward without getting stuck or sliding into chronic anxiety. So super, super important. Fantastic question. Thank you.
And Sam, your your presentation and everything you're sharing is generating an enormous amount of chat and an enormous number of questions. So everyone, will do our best to answer the questions that we can in the time available. And if we don't have the time available, I'm sure we'll be able to work out another way of bringing your answers to you. So Sam, there's another question here which both Tony and Mike have shared, and it seems to be a bit of a theme in the chat as well. They're asking, they'd be quite grateful actually if you could talk about managing anxiety as we're moving more into the virtual space, especially where we're unsure of whether support is nearby for the coachee, and often our coaching's occurring outside work hours. And Mike has added to that, he said, with the current social isolation system where a person may be anxious about the future of their job, career. Could you talk to us a little bit about how moving into a virtual space and the current situations we're finding in, what we can do about that?
Yeah, that's a really excellent question. Thank you, Mike. So it's got quite a long answer, so settle down, settle in for a bit of a long answer. So I think the most important thing to do in this situation is to make it standard in your coaching interactions to actually check in on a specifically COVID-19 basis. So always at the beginning of every session, I would check in with your clients and actually ask them what their situation is, how they're actually feeling, how are their anxiety levels, and normalize it by saying, everyone's anxious, I'm quite anxious, and what are the things that you're really concerned about right now? And that will bring up, of course, all those kind of really big issues about job loss, etc. Now, the second thing is that I think the assumption that everybody's anxiety levels are higher is a reasonable one. Now, everybody's different and everybody's an individual. I can see the chat box going a bit crazy, but it's really important to just make a safe environment where it's okay to say you're anxious. You know, it's really normal. And I think these things that people are worried about need to be engaged with specifically and directly. We're talking about bringing all the murky waters above the line, the top of that iceberg, the bit you can see, so that we can actually grapple with them and put some practical steps. Now, practical steps is really important, and you may find that your coaching sessions really change. You may have been on a trajectory with a client before COVID-19 where you were really helping support their deeply empowering process, causing them some amazing, or stimulating in them some amazing growth in them as people and their efficacy in the world. And I would like to think that that's the aim of most coaching, even in all its different guises. However, when we hit a crisis like we've been in for the last 6 to 8 weeks, what happens is that process kind of gets put aside slightly, and clients go into a different kind of mode. We all do, which is, what have I got my survival things sorted? So, you know, obviously in caveman times, that'd be food and water and safety. You know, am I going to get eaten? Now it's, is my job safe? Can I pay the bills? Can I pay my rent or my mortgage? Will I lose my job? Is my job safe? And those things are very real and need to be engaged with directly and really worked around. Now, often in these situations, here's where the answer is getting quite long. They are situations where we may not be able to do things about them. So in terms of money and finances, people can make claims from the government. They may be furloughed, as the UK expression is, you know, maybe getting JobKeeper. They may be practical things they can do about their finances. But things like, is my job safe? Will I end up with a job? Will my company fold? Will they make some people redundant? Are often things that nobody knows the answer to. And so therefore, if we don't engage with those in a new way, they are highly sponsoring of a deep chronic anxiety type of state. And that, of course, is not good for someone at all. So I think it's really important to work on some mindfulness techniques with these things. So acceptance that they are things they cannot control, and they need to be able to sit aside from rather than sit with it in front of them, if that makes sense to you. It's really important. So I often use the analogy of a deep, wide river, and you really want to get across, but to the other bank. because you just want to get to the other side, which is, I find my job safe, or my boss writes to me and tells me that I'm fine and my job is really secure. But all you've got is this little tiny kayak, and you sort of strap your poor little family into it and some provisions, and you try desperately to paddle across, and it's really exhausting and kind of impossible because the current's too strong. Whereas the alternative, a much better option, is to put yourself in the kayak, take your hands off the paddle and let the current take you downstream. And while you're doing that, you're accepting that these conditions are not something that you can have a direct impact on right now, right here. And in doing that, if you then, to carry on the metaphor, you look at the banks as you pass them, the river banks, and think, oh, well, look at those beautiful trees, or, look at that amazing city in the distance. You're basically being in the moment, and you're being open to other possibilities, and not, you're sitting in a space of not having to be in control. And it's always that control, switch on, switch off dynamic that's so difficult for all of us when we can't control big external situations that can make a huge impact on our lives. Is that answering your question, Mike? Or
Thank you. I think it is, Sam. Thank you, and I really appreciate you offering us those metaphors as well in terms of the kayak as well. So as we're concluding our session now together, we won't get to all the comments, but I have captured them all so that we can actually share them. So don't worry. There are a couple of final comments, and maybe one final comment from yourself, Sam. So Ian suggests that perhaps we should keep at the front of our mind that our role is to support and not diagnose. As Sam said, if you're not comfortable with what to do, then we should be seeking other professional support. And Lisa was saying that if a coach starts to work with a client anxiety, could we ensure that the client's not left in a vulnerable space without support at the end of the session? So Sam, any final comments from you? Everyone on the chat is thanking you, and also, saying how much we've learned from you. So is there any final comments you'd like to share with us before we sign off together?
Yes, I think the last couple of points are so important. If you feel out of your depth, don't do it. And yes, of course, you're in a supporting role. I think just helping a client will be helped who's anxious if your understanding is greater than it was before. So I hope that in this presentation, you've got a much better feeling about the complexities around anxiety and how prevalent it is and how normal it is in many ways. And really just watch out for that referral point when you feel like your client is so hindered and saying no to situations that they would normally say yes to because of their anxiety. And that's that point of referral. And I absolutely loved being a keynote speaker for this amazing things. I don't know if everybody knows out there, but Natalie from OpenDoorCoaching and Heather Jane, the CEO of Synergy Global, who I work for, basically put this event on in 10 days. And I absolutely love that in this time of anxiety and COVID-19 times when we're all making all sorts of adaptations, that they just got it going, sorted out the tech, and basically got it out there, and it's free. Really high, super high quality information. So thank you so much for inviting me, Natalie and Heather Jane. It's been an absolute delight to be part of this coaching week.
Well, you're very, very welcome, Sam. And thank you so much for your giving and your sharing and your contribution to our learning this morning. And the chat is absolutely agreeing. Everyone is saying it's a great balance of content and practical exercises and a very valuable learning experience. So thank you all for joining us here. We have a huge Coach Week program. We're only at the start of our program, really. So feel free to tap into all of those other sessions that are available. On behalf of Open Door, thank you, and Synergy Global, Sam, thank you for your presentation, and we'll say good morning to everyone.
Thank you and good morning.